Welcome to this Science Saves video. My name is Sophie and I'm a third year physics student at the University of Birmingham. The aim of the Science Saves programme is to raise the profile of healthcare science and its associated careers. This video is part of a series of interviews with healthcare science staff to find out more about what they do and provide information for people considering a career in the sector. I'm really interested in medical physics and I'm planning on applying to the NHS Scientist Training Programme, so I'm really looking forward to hearing what they have to say, and I hope you find it useful too. In this video, we're asking the question, why did you want to do healthcare science for a living?
I've been working in medical physics for over 30 years now, all in the NHS. I got into it because I really enjoyed physics, and as part of the A-level physics programme all those years ago, you had to choose two options, and I chose medical physics and nuclear physics. Really enjoyed them, and so that started my interests and my career in medical physics. I always specialised in radiation protection. I've spent the whole of my career in radiation protection. So that's looking after all aspects of radiation safety in the workplace.
So quite simply, it combines my love of learning and solving problems to being able to make a tangible difference to people's lives.
As a clinical scientist, I can answer this question in more than one way. First, in the short term, as a clinician, I enjoy making a difference to many people's lives. When, for example, developing analysis that increase the accuracy of a technique used to provide diagnosis that detects cancer in an earlier stage, that saves life. Second, as a scientist, I enjoy tremendous freedom in choosing the research and career path I want. Science in general, but genomics in particular, it is in constant development. Not only contributing to, but also enjoying being part of this historical era of biological discovery is more than a job for me. It is fascinating.
I always wanted to work in the healthcare industry. There's nothing more precious in life than health, and to be able to improve patient outcomes is the most rewarding job, I think. So when I've learned about clinical engineering, I really like the idea of working in a hospital directly with patients, assisting doctors, nurses, and other healthcare professionals. I also like change. I like getting involved in new things all the time, and clinical engineering role really allowed me to do that. I had a chance to work on a variety of projects, ranging from projects related to electrical engineering and human physiology, to leadership and project management, and even related to education just recently. So as you can see, work of healthcare scientist is never boring.
For me, the reasons that I wanted to become a healthcare scientist were as simple as I have a passion for science and I enjoy helping other people. Working for the benefit of others allows me to feel like I have a purpose to the work that I'm doing, and I'm working hard for a cause. I find it really rewarding, and it motivates me to do good every day.
I've always been passionate about science and research and enjoy helping and caring for others. Working as a healthcare scientist allows me to continue my research as well as branch into teaching at third level. It also has great job stability. I've worked through the whole pandemic and is well paid for a science physician.
I've always liked the idea of working in a hospital environment and providing care and improving people's health, and also had a strong interest in science and learning about the physiology of our body. So this role nicely combines both of these interests. We play a big part in diagnosing and monitoring patients, so having the ability to use my skills and my knowledge to improve people's lives is very fulfilling.
It really stems from my undergraduate and the wonders of elite physiology and human physiology generally. More specifically, I was very invested in cardiovascular physiology and its really complex intricacies. However, I didn't really consider a career in healthcare scientist until I heard about the STP and the challenges and the really exciting career pathway that offered, and the values of the NHS and its ability to really change lives really resonated with me, I'd say. And therefore, I thought an application to the scientist training programme would be a fantastic idea, and I'm so lucky to be on the programme now.
I wanted to do healthcare science for a living because I liked the idea of having a job where I was directly contributing to the health and well-being of others, I think is the simplest way to put it. And it's nice that across my specialism, whether you're a physicist in nuclear medicine who is administering therapies, or assisting a clinician in like reporting of scans, or you're working in radiation protection where you're doing the quality checks on these X-ray equipment, all of these have a direct link to delivering a fantastic service for patients. And I think that's really, really rewarding.
Thank you so much to all the healthcare staff who participated in this interview. It's really interesting to hear about what motivated and inspired you to take up a career in healthcare science. If you enjoyed this video and would like to learn more about the role of scientists in healthcare, then please subscribe to the Science Saves YouTube channel, where you can find lots more interviews with people working in the sector. To keep up to date, you can also follow us on Twitter and Facebook at SciSaves. Thank you for watching.